Here at home, Mayor de Blasio said the city will soon release data on the racial breakdown of coronavirus cases. And in fact, Governor Murphy in New Jersey did that today as well. This is an emerging storyline today. The numbers will likely show that the disease is disproportionately affecting people in lower income communities and people of color. News 4's John Chandler takes a closer look.
Nasim White is an essential worker. He keeps delivering food and keeps dodging the coronavirus.
The virus is taking a toll on me, but I try to stay positive.
Just days ago, his uncle died from COVID-19.
It's just a tough time for everyone, but we're pulling through.
The pandemic's danger is especially felt among essential workers.
Someone getting sick and getting us sick to go home to our family. That's one of our worries.
There is fear, too, of racial disparity in New York City's coronavirus infections. According to the city comptroller's report, 75% of all frontline workers are people of color, 19% are non-citizens, and 8% lack access to health insurance.
We can't wait. We want these numbers, and we want a real plan.
Public advocate Jumaane Williams calls for the city to release its numbers.
You can't put the decisions and the policy out and then say we're not going to put out the data. Well, then what are you using to make decisions? Are you just flying blind?
And so some says, well, don't play the race card. No, the card is already played when you look at the map.
In fact, New York City's most recent numbers show high rates of coronavirus infection include sections like Elmhurst, Queens, and East New York in Brooklyn. Mayor de Blasio doesn't dispute there is disparity.
Where we're not seeing disparity is the full court press to help everyone in need everywhere.
And so essential workers press on with the only plan they have.
We don't want to stay home and just not make no money. We have to make money either way because we got to survive.
In Chicago, numbers released showed 72% of coronavirus deaths there were among African Americans. And here in New York, when the city does eventually release its data, Mayor de Blasio cautions that it's harder to keep track of race inside of panicked emergency rooms rather than gender and age, just in the rush to simply treat patients. In Brooklyn, I'm John Chandler, News 4 New York.